Hey everyone, I'm here at PUSH511. It's Coach Jared. I'm with Dr. Randy Hallman from Canton Chiropractic, and we're going to go into a little bit of detail about plantar fasciitis and what you can do to take care of it.
Yeah, plantar fasciitis is a very common condition. A ton of people have heard of it, and there's a good reason for that. It is something that a ton of people get, as well as the fact that it's famous for its #1 symptom, which is the sharp pain in the heel of your foot first thing in the morning. It is an inflamed tissue which becomes easily abused through a lot of different things. The two things I see the most in my office are probably poor arch support, as well as overuse or maybe even abuse of the foot. Some of the examples that I see most often are people that are sightseeing around a new city and they are on their feet for hours at a time just wearing flip-flops, or maybe they are a construction worker that is on their feet for 8 hours a day with very poor insoles, or maybe even someone who signed up for a new 10K race and they are training for this with nothing but old shoes with very little support to them. The next question I often get is, why is it so painful first thing in the morning? And that's actually a fairly simple concept as well too. The plantar fascia runs from the heel of our foot all the way towards the balls, and it provides a lot of support for our arch. Overnight, you are no longer putting down that pressure on your arch, so it doesn't flatten out anymore, and it starts to actually give a little bit of slack to a very inflamed tissue. And then as you take your first steps in the morning, you put a lot of stretch on that plantar fascia, and that sends a burst of pain down and towards the arch of the foot. When you have plantar fascia, probably the plantar fasciitis, the thing you care about the most is just how to get rid of it. And so what I often recommend is a series of home exercises that people can try first, along with some other additional tools they can try. The big three are icing, rolling out the arch of the foot, as well as home exercises to target the arch and the calf. So the icing is simple. You can take a bag of ice, you can take some frozen peas, you can even use a ice pack. Just jam it against the heel of the foot, hold it for 10 to 15 minutes, and repeat that every few hours to try and reduce the inflammation. Rolling out of the arch of the foot is also a simple concept. You can use a lacrosse ball, you can use a golf ball, you can even use a can of soda. Anything that's kind of smooth, you can roll back and forth over top of the arch. Hit the tender spots for about 30 seconds at a time, move on to a new tender spot, and after about 2 minutes, give it a rest and maybe get back at it another day after that. Home stretches are probably your biggest remedy. Those are things that can vary from one doctor to another doctor, but the concept is always trying to stretch out the arch of your foot as well as the calf muscles, 30 seconds at a time, repeat it 5 times in a row, and then if you're fighting a bad case of plantar fasciitis, you're gonna probably do these stretches about every 2 hours throughout the course of the day. Those are the basic big three that I would recommend to most of the patients that come through my office.
That's great, Randy. Thanks a lot.
My pleasure.